Well, new today in Tech Talk, a Maryland woman who recently took home a prize at DC Startup Week is working on a way to help cancer patients using immunotherapy.
Yes, it's already being tested in rodents, and the hope is that it will be one day effective in humans. I caught up with her to find out the latest developments there.
Cancer will touch 40% of Americans. 40% of Americans will be diagnosed with cancer at some point in their lifetime, so it will touch us all in one way, shape, or form.
Cancer can be an earth-shattering diagnosis, and treating the disease can be physical and emotional. With that in mind, Martha Sklavos has developed allotherapeutics.
My background is as an immunologist and also spent some time here at the National Cancer Institute as well, and then went into biotech and pharma. And while I was there, I was really inspired by a dear friend's journey to really look at what can we do to treat later stage or hard to treat disease.
The goal is to restore anti-tumor immunity in patients to hopefully improve outcomes for patients with the advanced disease and or limited treatment options.
We're still about 18 months away from a clinical trial. We're currently raising money to get there, to get to the clinical trial and fully execute the clinical trial in a handful of solid tumors. So solid tumors are tumors like pancreatic cancer, breast cancer, prostate cancer, melanoma, those that are mainly an advanced disease or metastatic disease.
Sklavos recently took home the growth stage prize and a $2,500 check at DC Startup Week.
And so is it an injection, or how will it get into our system?
Yes, so it will be administered either at biopsy or at surgical tumor removal, and it will be injected into the tumor. Our therapy is a cell-based therapy that also has another immune activator kind of together with the cell-based system to just make sure that we're engaging both arms of the immune system. So our goal is not to disrupt cancer care protocols.
Right now, allotherapeutics is being tested.
But we have tested it in animals for safety and efficacy of this kind of transplant rejection mechanism, and we've seen that it's safe and effective in mouse models.
And the hope is that it will be available in the near future to humans.
If the results are really good, that's when you can kind of accelerate that development path and approval. So I would say, best case scenario would be 5-6 years if everything lines up perfectly.
A perfect example of how technology is helping people improve their health.
Yes, I've seen the impacts of cancer so many times, so glad to see this. All right.